The 2025 March of Dimes report card shows that 10.4% of births in the United States were preterm. In Pennsylvania, though, the numbers were much higher, at 9.8% of births being preterm. UPMC Horizon and Farrell just received recognition from U.S. News and World Report as a high-performance maternity care hospital, and also received a maternity care access hospital designation. So what makes UPMC Horizon's maternity health care stand out? I'm joined now by Dr. Elizabeth Worth. She's from UPMC Horizon, here to tell us so much more. Doctor, thank you for taking the time.
Absolutely.
Yes, so UPMC Horizon's maternity care was awarded two incredible distinctions. What makes the hospital different in terms of the care you offer?
So here at UPMC Horizon, we're able to use the resources of the system that we have with UPMC and still offer our patients high level of care in a more remote sort of setting. So we have availability to 24-hour anesthesia and pediatrics teams, which will allow us to give a high level of service of care despite our remote setting.
And we talked about the numbers. For those who don't know, why does a preterm birth even happen in the first place? How does your hospital notice that and treat the symptoms?
Yeah, so unfortunately, we don't have a great understanding of why some women go into labor early. So we do talk about them throughout their pregnancy, about different signs and symptoms to watch for. We're also monitor, other causes for preterm delivery, such as high blood pressure, or other complications of pregnancy, to try and help treat things early and prevent those preterm deliveries.
And when you hear about the higher preterm births, especially the stat from Pennsylvania that I mentioned, higher than the national, where do you believe work needs to be done to make improvements in some of the access to the care across the state of Pennsylvania? What do you think maybe needs to be addressed first?
Rest of the nation, where our more rural areas are having a harder time achieving adequate access to prenatal care. So currently we are the only hospital in Mercer and Lawrence County providing OB care. So we try and do outreach, and we have offices in different locations to try and reach our patients where they're at. But unfortunately, we have several patients who have to drive, 45 minutes to an hour to reach the hospital, which is happening in Pennsylvania and across the United States.
Yeah, and access is a huge issue. That's what I hear about a lot among my peers, too. It's that they have to drive or they can't find a doctor.
Absolutely, yep.
Yeah, in 2023, the World Health Organization named the U.S. one of 7 countries that saw a significant increase in maternal mortality since 2000. So we're looking at, where do we fix the gaps in care? How does UPMC Horizon ensure that they lower the risk for those complications? What are some of the extra steps you think you take?
Yeah, so we have great access to a variety of different subspecialists, including the high-risk doctors. All of our ultrasounds here are read down by the high-risk specialist, which has helped improve our patients' access to those doctors. They also can receive co-management of care, receiving some of their care with us and some of our care down there, trying to increase that access to some of those subspecialists that are unable to reach out to the communities themselves and help improve our pregnancy outcomes.
All right. Congrats on these distinctions, and thank you so much for joining us on an important issue to bring awareness to. Thank you.
Thank you very much.